So in today's video, we're going to be talking about TMS therapy for depression. With me today, I have Dr. KevinMurphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm a oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So doctor, can you tell me a little bit about depression and TMS therapy?
The primary indication for TMS began as a treatment for refractory depression, major depression disorder that was not responsive to medication management or shock therapy.
Okay.
And that's really how TMS really started clinically in that subset of patients, largely in psychiatric clinics or with psychiatric doctors treating that subset of patients. That indications have now broadened to a lot more things, but right now the current insurance coverage across the United States is for major depression disorder as the most commonly applied for insurance coverage. And it has the largest amount of probable use amongst all the TMS centers. Depression is probably the most common symptom that patients are having. Symptoms of depression are not often by themselves. So
Right.
PTSD patients, you can have postpartum depression. The reasons why you have depression are varied, of course. And we see concomitant anxiety in the vast majority of patients that have depression. And that seems kind of odd that you have both depression and anxiety, but we see that really in a large number of our patients. Both the anxiety and depression respond to treatment. In contrast to standard TMS, in our clinic we use personalized RTMS. The P is the personalized part of that. What that is it involves taking electroencephalograms and looking at the brain state in all 19 different locations. And you're looking at the brain speed, like a speed map. And you're looking at the amount of depression, the delta theta energy we see on these scans. And we watch that dissipate as we treat patients as a marker of improvement.
Okay.
And so we take the scores, the standardized scores, and we also look at the amount of energy on a spectral EEG that's in those areas that we know cause depression. So it's very rewarding to watch those thick bands of energy we see that are very depressive thin out and become neuromodulate or move to a faster brain state. It absolutely corresponds. In our clinic, we're probably seeing a 50% reduction on average in the depression scores after PRTMS.
Okay. And how many sessions?
Usually 30 to 40 treatments.
Okay.
6 to 8 weeks, and we're seeing on average, and we're going to be publishing this data on PTSD and also concussion patients that have comorbid depression. And in our experience, we're seeing, and in our experience, we're seeing about a 50% reduction in their scores.
That's amazing.
Yeah.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.